I am Becky Abbott. I'm located in Slinger, Wisconsin. I'm the co-chair of the Family Driven Advocacy Committee, and I want to welcome you to Advocacy Day training for our virtual day on the Hill. I have two sons named Ryder and Lachlan, and my third son is Aiden, and he has XLHED, and that is a form of ectodermal dysplasias. So we're happy to have all of you here today. With us is also Lincoln Clapper from Advocacy Associates. He will be speaking first and going over information about Advocacy Day schedules and how to access them and the information that's on them. And then also Kevin. Kevin, if you want to introduce yourself.
Hey everybody, my name is Kevin Koser. I live in just outside of Charlottesville, Virginia with my wife, Rachel, two boys, Cannon and Cage. Cannon is 5 years old, and he also has XLHED, ectodermal dysplasia. And I'm Virginia state lead for advocacy, and been doing this on the advocacy committee for a couple of years. So really enjoying it, and hopefully this is a good training session for you all.
So as I said before, welcome ELSA advocates. We have quite a few families from the National Foundation for Ectodermal Dysplasias joining us. We also have many different ELSA advocates also who are joining us on the Hill. So I want to welcome all of the different organizations who are joining us, the different ELSA advocates, the advocates who have other congenital anomalies, and then also members of supporting organizations, as well as the medical community who is joining us. This is a team effort, and without all of us working together, we would not have been able to garner this much support. And we will not be able to move ELSA forward unless we all work together. So this is the training agenda. I'm just going to go over this quickly, and then I will stop sharing my screen and Lincoln can take over. So tonight, as I said, first of all, we have Lincoln Clapper from Advocacy Associates, who's going to be going over all the information you're going to need to know on how to access your online schedule for Hill Day. We are going to discuss what the Ensuring Lasting Smiles Act, or ELSA, is. We're going to talk about the current status of ELSA, what to expect during your virtual day on the Hill, how to prepare for your meetings. We'll share some tips for successful meetings on Capitol Hill Day. We'll also talk about how to stay connected and build relationships with legislative offices. Kevin and I will have a mock legislative meeting towards the end. And then we'll also talk about our social media contest that we'll be rolling out in a couple of days, and then have a question and answer session. I just want to mention that after Lincoln speaks and he's done with his slides, we will open up the Q&A for probably about 5 to 7 questions. After those 5 to 7 questions, we are going to end that portion of the Q&A and move on with the rest of the webinar. So if you have additional questions, please save them till the end or type them in the Q&A box, and we will get to them at the end of the webinar. Go ahead, Lincoln.
Thanks, Becky. Good evening, everyone. My name is Lincoln Clapper. I'm part of the Advocacy Associates team here in DC, and what I want to spend about 10 minutes or so sort of walking you through how you're going to be navigating your online platform for your schedules for next week. With that being said, I'm going to pull up my deck and we'll get rolling here. So this Friday is when you will be getting the initial email from us with a link to your schedule for next week. Now it's going to come from Advocacy Day at advocacyassociates.com, highlighted here in green. So keep an eye out for that domain. Within that email will be a link to your schedule, highlighted here in red. So every advocate has a unique link to their schedule. You don't need to create an account. You don't need to create a password to get your schedule. It will automatically log you in when you click on that link. If by, say, close of business on Friday, you haven't gotten this email from us, go ahead and check your spam or junk folder. It more than likely ended up there. If you do find it in that folder, go ahead and unmark it as spam and follow whatever directions you have in your email settings to make sure it doesn't go there again, because this is going to be our main way of corresponding with you in terms of scheduling updates, timing, cancellations, additions, all of the above will come through via email. So we want to make sure you're getting that. Now, the first few slides I want to go talk about our troubleshooting. So if for some reason your browser may not save cookies properly, or just in playing around with the platform, you become logged out for some reason, What you want to do is, if you end up at a dashboard like this, is click on the Send Me a Sign-in Link button. Don't try to enter a username or password. Just click the Send Me a Sign-in Link button. It'll take you to a dashboard where you can input the email address that you registered for this event with. Click Send Email, and you'll get a new refreshed link to your schedule, and you'll log right back in. Now, if for some reason you're still not able to get in at that point, or you're having some issues, go to our support tab in the upper left-hand corner, and then indicate you're having trouble accessing the account. Fill out this questionnaire. This will go directly to our development team. They will reach out to you individually and get any issues resolved you're having. Now, once you're launched into your schedule, you're going to see a dashboard that will look like this. You'll see all of your confirmed meetings on the top part of your page. If there's any pending, they'll be displayed on the bottom as TBD. Once those are confirmed, you'll get an update from our system letting you know that the meeting was confirmed, and then you'll see it slotted into your schedule appropriately. Please note that all times listed on your schedule will be in Eastern Time, and this is uniformed across the entire platform. We have taken into account where each of you live. So based on your time zone, you're going to have schedules that take place during normal business hours for where you live. So for you people on the West Coast, don't worry, you're not going to be waking up at 5:30 to do these meetings. I will be reviewing some information later about how our system sends reminders just to keep everybody on track throughout the various time zones as well. Now, in order to get the content for each meeting, just hover your cursor or your mouse, any part of that module, click on it, and you'll be launched into the meeting dashboard. This will show the time and date of that meeting at the top, followed by who you're going to be speaking with in that office, whether it's staff, member of Congress, or both. If you have a meeting lead that's been assigned to your meeting by the NFED team, you'll see that attendee's name displayed there. If not, then this area will not show up. Now, in order to access the video component for the meeting, just simply click on the Join Online Meeting button. We will be using the Zoom platform, so 99 out of 100 meetings will take place on the Zoom platform. Our passcode has already been embedded for these links, so by clicking on that, you'll be automatically logged into the meeting room. Some offices prefer to use their own, like I said, very select few, like Teams or WebEx, etc. Same concept. Once you click on that button, it'll open up that particular dashboard for that event. But 99 out of 100 meetings will take place over Zoom and have a video capability. In addition to that, there are a few offices that do not have video as a preference. So we'll have a dial-in option. You'll see a disclaimer on the button if there is no video component. However, like I said, almost all, if not all, of your meetings will have this video component. So you can go ahead and click on that button to get yourself launched into that meeting room. There also will be dial-in information associated with every meeting. So if you're not able to access via video, you can dial in as well. And so just follow the directions for the access code and the PIN, and you'll be launched into the room appropriately over your phone. The upper right-hand corner will be all of your talking points. Becky and her team are going to be reviewing all of that later, but you'll see those talking points displayed in this area here. Beneath that will be a document section. So these will be all of your supplemental talking point documents. Simply click on each file. It'll open in a separate tab on your browser. It won't take you away from your schedule. So you can have your schedule, your documents, and your Zoom window all open at the same time, and will make it real easy for you to navigate across those different modules throughout the course of each meeting. Beneath that will be a list of the attendees who are in that meeting with you. There may or may not be some relevant contact information for them as well. You're also able to contact them via our peer-to-peer chat function. So simply just click on that blue chat bubble and you can send a direct message to another advocate. If somebody is trying to message you through our system, you will actually get a notification about that. The left-hand side is our report form area. The first one is the check-in feature. We're asking everybody to click this check-in button either shortly before or shortly after your meeting concludes, letting us know that you were present, because we'll be sending this attendance report to the NFED team after the event concludes. The send thank you note will be a pre-written thank you email script that Becky and her team have crafted for you. You will send this, you will have the ability to send this email on your behalf to the office after the meeting concludes. You can obviously edit it as well if you need to personalize it or customize it, but it'll pretty much be written out for you in terms of who to send it to. Our system will pull the staffer's information for who you met with. The subject line will already be pre-filled as well as the body of the email. You can open it in one of two ways. First, click the open email button at the top, the blue button. it will open whatever your native platform is on your computer. So for example, I have Outlook. If I were to click on that, it would pull up an automated Outlook email for me. If you don't have a native platform system on your computer or laptop, simply click on those copy clipboard buttons, the 3 buttons beneath that. You can then paste it into your Gmail or Yahoo or whatever email platform you have to send emails. Beneath that will be a meeting report form. So these are feedback questions that have been specifically crafted by Becky and her team. Please go through and answer those after the meeting concludes. Go through them one by one. When you get to the bottom, you can click submit answers and then you'll be all set. It'll take you back to the home page. The take notes feature is essentially a blank notepad. If you don't have pen or paper available, you can take bullet point style notes on this. You can do it in complete sentence format. It's really up to you. It's optional, but it is an extra resource for you to utilize if you'd like to take freehand notes during the meeting. Beneath that is an option to select whether the member of Congress attended or did not attend. For those of you that have done this event before, you know the meeting may be scheduled with a member of Congress, but they get pulled away to votes or they're stuck at a committee hearing and they're not able to attend. This just helps us get a very accurate account of which members of Congress were present for the meetings. So go ahead and mark one of those after each meeting concludes as well. And then lastly, there will be some social media functions. So you're able to post directly to Twitter or Facebook or LinkedIn if you're logged into those accounts. Simply click on each button and you'll be taken to the dashboard to drop a post after each meeting. Once the meeting concludes, just click on the meetings tab at the top part of the page. It'll take you back to the home page where you can then navigate your way to the next meeting. The legislators tab is an area where you can view bios for each member of Congress. You'll also have links to all their social media pages, such as their Facebook or Twitter. You can also go to their website and check that out as well. The bills section will pull any relevant bills you may be tracking. It'll show the vote history of how that member's voted on that bill at the bottom. If you are not tracking any bills, then this area will be blank. The news section will pull any relevant news articles that member has been mentioned in across various internet articles. And then committee assignments will list all the committees that member of Congress serves on. The last 3 options on our top bar are our messages tab. That's where you can view those peer-to-peer messages between yourself and other advocates, all your individual conversations. The directory tab is a master directory for everyone in the event. So you're not just limited to the people in your meetings. You can contact anyone across the organization. Then the support tab will be your best friend in terms of any issues at all, scheduling, technical concerns, really any concern at all. Go to the support tab, fill that out. That'll come directly to our team, and then make sure it gets appropriated to the right person. The more section is, the more tab, sorry, is basically just another way to view all the content I've already reviewed just from the home page. So you can see how that works as well once you get logged into your schedule. My last slide here, I just want to spend some time on relevant information and reminders to keep handy. Again, check your spam or junk folder if by close of business this Friday you haven't gotten an email from us. Our domain is @advocacyassociates.com. Some of you may need that information in your settings to unmark us as spam. We're asking everybody to get into their meeting, whether you're calling in or via video, 5 minutes prior to the start time. And this is really just to touch base with your group about who's going to open up the conversation, but also to make sure you give yourself some bandwidth in case maybe you're running a little bit later, you're having some Wi-Fi issues and you need to move rooms in your house. We just want to make sure everyone's present when the office joins. That way the meeting can start right on time. Please note, again, all times on your schedule will be listed in Eastern time zone. However, you're going to get a reminder email from us 1 hour prior to every single meeting throughout the course of the day with a link to your schedule. So don't feel like you need to keep one email draft handy in order to re-access your schedule if you go away from it. We're constantly going to be updating you with it. We're going to make it as easy as possible for you to get in and out of the portal throughout the course of the day. If an office doesn't join your meeting within 10 minutes past the start time, go ahead and have your group hang up, get off the Zoom, have somebody from your team contact us. And our help number will actually be listed in the support tab if you need to call us for a time-sensitive issue like that. Sometimes members and staff run late, just like everybody else. So give them a 10-minute buffer to join before you contact us. We do want to know about it at that time because we want to reach out and reschedule with them for later in the day. Please also know that meetings have been scheduled in 15-minute blocks. These may probably go longer. That's generally what we're seeing in our virtual environment, but do approach each meeting in terms of crafting your pitch and reviewing your talking points, knowing that that it's been arranged in 15-minute increments. Any changes to your schedule the day of the event will be sent via email. So again, make sure you're checking that very regularly throughout the course of the day. Make sure you're seated in an area with good Wi-Fi connection if you're going to be utilizing the video component, as you'll be needing that for your Zoom. Please mute your microphone whenever you're not speaking or whenever it's not your turn. And just know your audience. Ensure you have an appropriate background, as you'll be speaking with both Republicans and Democrats throughout the course of the day. So that being said, very much looking forward to next week. I quickly looked in your database before we got rolling here, and I think we were up to 375 advocates and almost 270 meeting requests. So it's going to be quite an impactful day for you all, and I'm looking forward to it, and I'm happy to answer any questions that have come through.
Lincoln, there's, I believe, 4 Q&A. Can you view those, or did you want me to read those off to you?
I can pull it up, yeah. Why, when should you use the contact attendees function through the platform before, after meetings, or to communicate during the meeting? It's a way for you to really touch base with other advocates in your group ahead of time. If you don't know them, maybe you can set up your own introductory phone calls with each other, or you can set up your own practice session over the weekend before the 28th. So it's really for you just to establish a way to communicate with each other without having to go through the NFED team. As I said, there's over almost 400 people. So in order to sort of limit the traffic of getting somebody's contact information, you can contact them directly through the platform and get that yourself. How do we get the meeting notes page? I missed seeing it. So the meeting notes, you just simply click on the Take Notes button. It will pull up a blank notepad for you. Your talking points will already be displayed as well as your documents. Simply click on those and they'll download in a separate tab. And you'll see there's only one dashboard for the meeting, so it's not like you have to navigate to 4 or 5 different places. Once you click on that particular meeting, all the information you need will be in one place. Is there a means to access the interface to become familiar with it before the meeting? Yes, so as I said, you're going to be getting this on Friday, and so you'll have all weekend and Monday and Tuesday of next week to familiarize yourself with the platform and get used to navigating it. If my 20-year-old daughter can attend with me from her college apartment, can I share the link? No, she will need her own login in order to access it. In terms of adding her, that's not an issue. Just contact the NFED team with her information, so we can get her an email with her own link to her schedule, and she can join the meetings with you. And I think, there's a few more that have come through here. I believe it was mentioned in the initiative that there was a list of who we'd be meeting with available on the website, so we could see who is currently supporting the bill and who isn't. I wasn't able to find that the other day. I think, Becky, that might be for you.
Yeah, we will provide a list of all of the current co-sponsors, as well as the co-sponsors in the Senate who are on the waiting list. Those will also be on your schedules. Mm-hmm. So look for it there.
Yes, they will be. And then we have an issue about children joining the meetings. Certainly not a problem. I think it's probably really encouraged. Becky, if you want to expand on that.
Yes, it is encouraged. I was on a virtual day on the Hill probably about a month and a half ago, and I had a 2-month-old at the time, and he joined us in our meetings. Just make sure that if kids are getting to be a little bit naughty or loud, that you mute your line so that other people can talk during those meetings, and that you're not taking up other people's time. But yes, you can have kids sitting on your lap while you're talking during the meeting. And like I said, just be mindful of the other advocates, that if they're being loud, to mute while they're speaking.
And I don't think anything else has come through. As I said, one more reminder for everyone before I hop off. This Friday, that will be April 24th, right? Yes, 2020, right? Or is that, sorry. 23rd, April 23rd, Friday is when you all will be getting schedules from us. So keep an eye out in your email. And then if you have any issues getting in, go to the support tab. That'll go to our development team. Otherwise, you'll be off and running, and you're all experts. And we're looking forward to next week.
Thank you so much, Lincoln. We appreciate it.
Okay, take care, guys.
All right, everybody. So here's the fun. We get to talk in depth about the Ensuring Lasting Smiles Act. This is the sole reason we are all participating in this virtual day on the Hill. It's the reason we're all advocating. Whether it's you, a family member, a friend, a patient, we're all here because we want to make sure that all people can get the medically necessary care they need to treat or repair a congenital anomaly, birth defect. And personally, aren't we all sick and tired of doing everything right, everything in our power to make sure our loved ones can get the best and most timely care possible as they navigate life with this congenital anomaly? I know that falls into my boat. The Ensuring Lasting Smiles Act will directly address the issues we've been facing, giving our loved ones real ground to stand on when they submit healthcare claims or appeals for treatments of congenital anomalies. This will probably be a refresher for most of you, but regardless, these next couple of slides will give you all the basic information you'll need to talk to your federal legislators or their staff about ELSA. So the objective of the Ensuring Lasting Smiles Act is to make sure that all private, group, and individual health plans do not deny or delay medically necessary treatments of congenital anomalies. What's important to understand here is that public or government health plans will not be affected by ELSA. Government plans like Medicare, Medicaid, TRICARE, VA, or federal employee health plans are not under the purview of ELSA. But ELSA is step one in our ultimate journey to make sure that all health plans will eventually cover claims for congenital anomaly treatments. Private plans cover approximately 2/3 of Americans. So that's why ELSA is step one. It makes the biggest impact up front. So that's why we're focusing on the private plans first. The foundation is that ELSA is broadly written based off of 50 state laws that already require insurers to offer coverages of congenital anomalies. But what's important to note here is that that's a very strong foundation and that they exist in all 50 states, which is huge. But state statutes are unequal across the board. Some are easier to navigate than others. And state laws don't always apply to plans that are regulated by the federal government, such as ERISA or self-funded plans. In general, we're all here because we know somebody who's been affected by a congenital anomaly, and that applies to about 4% of Americans. We found that ectodermal dysplasia community is not the only one who's negatively affected by current insurance laws or the lack thereof. These are, you'll see on this slide, some of the many examples of other congenital anomalies that would benefit from ELSA. Skeletal defects, vision defects, hearing defects, you name it. If it's a congenital anomaly or birth defect, this bill will help you. Next slide. So bottom line, any medically necessary or any medically diagnosed congenital anomaly that requires care treatments would benefit from the passage of ELSA. At the end of our day, our vision for ELSA is to bring smiles to all of you, your loved ones, your patients. And just imagine the smile on your faces when they can finally receive the care that they need and know that their insurance benefits will apply. Imagine the smiles on their faces when they no longer have to make life-altering financial decisions just because of insurance's failures to approve medically necessary care. And best of all, imagine the smiles on their faces after they receive their dentures or dental implants so they can eat, or hearing devices so they can hear, or lenses so they can see. And that's our goal. And so we're really happy to have you on this journey with us. Next slide. All right, so these four folks, fine folks on the Hill, are the ones who are making this journey possible. These four legislators have reintroduced the Ensuring Lasting Smiles Act on March 16th. And there has been some turnover over the last couple of years. We've had some amazing bill leads in the House several years ago, but these four are a truly remarkable team that can help us get ELSA to the finish line. Senator Tammy Baldwin, Senator Joni Ernst, Congresswoman Anna Eshoo, and Congressman Drew Ferguson. Next slide. So now you know the objectives of ELSA and who's joining us on this journey, but what's next? So let's talk about ELSA's current status. We started off the 117th Congress, which spans these next 2 years, 2021 and 2022, with a lot of momentum, evidenced by a huge number of original co-sponsors. Those are the members who signed on to the bill before it was even introduced. But where ELSA goes between now and January 2023, when the 117th Congress is over, is entirely up to you. We're going to need your active participation for all of these next 2 years. Advocacy is about building relationships with your House and Senate offices, and this virtual day on the Hill could be the first step for you and your family, or it can give you the chance to re-engage offices you've met with in the past. It's imperative that you help us keep the momentum behind this bill all the way until it's on the president's desk for signature. Next slide. I mentioned the huge amount of co-sponsors. This encompasses the original co-sponsors in the House, plus new offices that have signed on since introduction. So key things to note here. At the top, you'll see the bill number, HR 1916. That's a new bill number that took place on March 16th when it was reintroduced. So this is the new bill number. Right now, we have 172 co-sponsors in the House, plus Congresswoman Anna Eshoo as the primary. You'll see the split. Democrats are in the majority, Republicans are in the minority. But what you should take from this slide is that this is huge bipartisan support. Co-sponsoring, as I mentioned, it's a tangible show of support when a member signs a piece of paper saying, yes, I support this bill. But co-sponsoring isn't everything. So even if a member declines to co-sponsor, it's okay. We'll talk about what to do under those circumstances later, but just know that this number is huge. And the fact that we've only done this in 1 month is truly amazing. At the bottom, you'll note several offices that are currently vacant for various reasons. There have been several deaths on the Hill. There have been several folks who have left their position in the House so they could take a position in the presidential administration. We're tracking all of these offices very, very closely. Next slide. And here you go with the Senate. Same thing, it's a 50-50 split. But Democrats are in the majority because of the vice presidency being a Democrat with Kamala Harris. So we have 17 total Democrats, 16 total Republicans who have signed on, but key difference here. You'll see at the bottom, a Democratic wait list. The goal here is to keep ELSA as bipartisan as possible, evidenced by the 50-50 split within the Senate. So what we're trying to do, what our sponsor offices want to do, is for every Democrat who wants to be added, there needs to be a Republican. So there are 6 current Democrats who are not officially on congress.gov, the website where it tracks all of these co-sponsors, but just know that those 6 Democratic senators have pledged to co-sponsor the bill. And again, at the top, the new bill number, new Senate bill number is S754. So keep that in mind as well. Next slide. All right, so this is a general overview of where ELSA could go here in the 117th. For the House, there are 3 committees that ELSA has been referred to: Energy and Commerce, Education and Labor, and Ways and Means. What we're waiting for those committees to do is take action on the bill, whether it's a legislative hearing, a markup session, and ultimately a vote within the committee to get ELSA down to the House floor for a vote. There's an alternative route. This was new as of 2 years ago. It's called the consensus calendar. This is where co-sponsors play a very important role. If we can get to 290 House co-sponsors, which is 2/3 of the House, it essentially forces the House to take action on the floor, possibly bypassing the committees with their consent if certain conditions are met. So all that to say, co-sponsors can play a critical role for us, and that is going to be one of our primary asks for this advocacy day. In the Senate, there's 1 committee with Education, Labor, and Pensions Committee, otherwise known as the HELP Committee. That is the only one. And we're essentially waiting on the same thing, committee action. Will they schedule a legislative hearing, markup session, and ultimately a vote to pass it to the full Senate for a vote? Next slide.
Thank you, Kevin. So now we're going to talk about what to expect during your virtual day on the Hill. Hold on, my computer froze. Sorry about that. So this is our timeline for Wednesday, April 28th, which is our virtual advocacy day on the Hill. At 8 a.m. Eastern time, Mary Fate, who is our NFED executive director, will have a Facebook live kickoff. And I just wanted to mention, I often get emails from advocates that they want to know if these activities in the morning are mandatory, particularly the advocates who are in California. And you do not have to participate in these events. These are optional, and we will also have them on a recording that we will send via email the week after. After Mary Fate, our executive director, kicks off the day on the Hill, we will then have brief messages from our 4 bill leads. Those will start at 8:10 a.m. Eastern time and will go to 8:25 a.m. Eastern time. So first of all will be Senator Baldwin, Senator Ernst, Congresswoman Eshoo, and then Congressman Drew Ferguson. And those will be posted to Facebook and Twitter. Then directly after that, we will start our virtual legislative meetings with our US senators and our representatives. After our meetings, we will have a Zoom wrap-up party. If you attended last year, it was really fun. We had a lot of great stories that families shared, and the information from their different legislative meetings was shared, how they went, what the advocates enjoyed from their meetings. So I would urge you all to go to that wrap-up party. So what to expect, your legislative meeting process. Most advocates will have between 3 to 5 legislative meetings. If one of your legislators cannot attend, you may only have 2. If you have a large group, for example, California again, or Florida, you may have more meetings as you may be grouped in with other advocates from your state. So each advocate should have 2 US senators and 1 representative meeting. And like I said, if one of your legislators can't meet, then you will not be able to attend that meeting because it will be canceled. Each meeting will be approximately 15 to 20 minutes. And as Lincoln said, it could be a little bit longer. If the member has extra time to talk or the staff member has extra time, they may ask you questions until they have to get to the next meeting. You're usually placed in meetings with additional advocates, and those are advocates from your state or the district you live in, or area districts that may only have 1 advocate. And we usually try to group them together so that you're not in the meeting alone. Each family will have 1 to 2 minutes to speak. So as Lincoln had mentioned previously, the event is completely virtual. Your online schedule will be sent to you by email with links to attend the meetings. Most meetings will be via video conferencing, and I would encourage all of you, if you have that option, to use that option. It's always better to be in person and allow the staff and members of Congress to see you. Make sure that you have your key information in front of you. And of course, the asks will be provided, and we'll go over that in a little bit. Your meeting notes will include committee assignments if a member that you're seeing is on one of the key committees that Elsa was referred to. Check your email often for last minute changes or cancellations. And then, as Lincoln had mentioned previously, all meeting times are in Eastern time zones, so you need to take that into account. If you have a conflicting time, meeting time, or if there's a meeting you cannot attend, please contact me up until the day of, and do not cancel your meeting with that office. If you have any issues the day of Advocacy Day, please make sure that you contact the Advocacy Associates representative through that link that Lincoln mentioned. So what to expect, your legislative asks. If a member is not co-sponsoring, you need to ask them to please support and co-sponsor the Ensuring Lasting Smiles Act. If a member is already co-sponsor, you need to thank them for co-sponsoring the Ensuring Lasting Smiles Act. And then also ask them to please reach out to their colleagues, the leadership, and also other committee members if they are on one of the assigned committees, to indicate your support and prioritize ELSA's passage in the 117th Congress. And then there was somebody who had asked about how to find out if co-sponsors or what the current list of co-sponsors are. And we will provide the 2 links to the US House and the US Senate, so you can check to see if your members are co-sponsors or not. And please remember that those statuses can change at any time. Those co-sponsors trickle in slowly. So as soon as they are added, they get put on to congress.gov. It usually takes a couple of days. So I would go ahead and check that all the way up until Advocacy Day. Okay, so conducting the meeting if a member is not a co-sponsor. As Lincoln had mentioned previously, there will be team leaders assigned to each meeting. That will be on your online schedule. I will also be reaching out to all of the team leaders ahead of time so that you know if you're going to be a team leader, and you can then ask any questions you may have. So if they are not a co-sponsor, you need to ask your legislator to support and co-sponsor the Ensuring Lasting Smiles Act. And then also B, to help push the bill through committee if he or she is a committee member. So after that team leader goes through that information, then we ask all families to share your story. So the team leader after that would mention, we have several families who would like to share their story. I'll have this family go first. And then that family would share their story. Once that family is done, then the next family would share their story. Usually the team leader will name off the last name of the family. So for example, I would say, Abbott family, share your story first. Once they're finished, then the Koser family could share their story. The team leader will then explain that ELSA has strong bipartisan support in both the US House and the US Senate, with whatever number of total co-sponsors there are that day. And then also, since it was reintroduced on March 16th. But we also need to mention that we still need your help to make sure it passes and gets signed into law. So even though we have a lot of co-sponsors, we still need to build those numbers, and we still need additional support. Then to close out the meeting, the team leader will ask again, will you please support and co-sponsor the Ensuring Lasting Smiles Act to help families like ours, and then make sure you thank them for their time. Once again, the team leaders will be noted on the schedule. The committee members will also be noted on the schedule, so look for that information. And then also understand that some members cannot co-sponsor the Ensuring Lasting Smiles Act. So for example, if you have a meeting with, I'll just name off a couple of them, Senator Majority Leader Schumer, Senator Minority Leader McConnell, some of the committee chairs, some of the ranking members, Speaker Pelosi, they will not be able to co-sponsor, but we still need their support. So those meetings are very important. This is the information on how to conduct the meeting if the member is already a co-sponsor. So first, the team leader needs to thank the legislator for co-sponsoring the Ensuring Lasting Smiles Act. The team leader also needs to ask either the member or the staffer to help move ELSA forward, of course, by reaching out to colleagues, leadership, committee members, if they're on a committee member. And then they need to indicate their support for this legislation, and that we asked them to prioritize ELSA's passage in the 117th Congress. After that, then the families would then share their stories, and each family, of course, gets 1 to 2 minutes to explain their story and ask the legislator to help move ELSA forward. The team leader would then explain, again, that ELSA has strong bipartisan support with a number of co-sponsors, but that we still need their help to make sure that ELSA gets passed into law. Once again, the team leaders and then also the committee members will be listed on the schedules. So how should you prepare for your meetings? I know I've received a lot of emails lately, families practicing their story and sending it to me and asking if there should be any information that they should add. That's one good way of preparing for your meetings, and I would encourage you to do that. So how to prepare? Write out your personal or patient story. If you are a member of a patient organization and you're not the actual patient, you can share other patient stories. Just usually keep it vague. Don't mention their names, and explain how the legislator can help them if you are not a patient yourself. Practice verbally sharing your story. I can't urge you enough to make sure that you do this. Sometimes you think your story is going to be very short, but in all actuality, it can be 3, 4, 5 minutes, and we simply just don't have the time for every family to share a 5-minute story. So make sure that you practice to make sure that you have it down to 1 to 2 minutes. Again, access your online schedule and review. I know there's been a lot of questions about people wanting to know how to access it, what information, and I would urge every one of you, as soon as you get that email, go on to the website, access your schedule, and go through all the materials, all of the talking points, the committee assignments, the co-sponsor information, so that you know all of the information for your meetings. Team leaders, review talking points and materials in Advocacy Associates portal for meetings. Determine which ask applies for each legislator. So you may have 3 or 4 different meetings that day, and 2 will be co-sponsors, 2 won't be co-sponsors. So you need to differentiate between what ask will apply to each office. You do not need to be an expert on ELSA, just focus on your personal story. There may be legislators who ask very hard to answer questions, and don't worry about that. If you don't know the information, you can just type that into the notes, and then a member of our advocacy committee will follow up with those offices afterwards. As we've all mentioned, please check your emails often. Make sure that you're checking the email that you registered with for Advocacy Day. I know a lot of us have several different emails, and you need to make sure to check the one that you registered for Advocacy Day. Check for any last minute schedule changes, cancellations, and then again, we're going to keep mentioning it, they're all in Eastern time zone. If any issues arise, please contact me up until 4/27, which is the day before Advocacy Day. But the day of, which is 4/28, please go onto your schedule and contact Advocacy Associates through their portal. So we need your story for Hill Day, and I have received several of them from families. We're asking you to type up why you're advocating for the Ensuring Lasting Smiles Act and send it to us with photos if you're willing to allow us to use those photos. We want to hear what your experience has been, if you've tried to get treatments for you or your loved ones and you haven't been able to get them, or you have been able to get them. If you have photos that you're willing to share, please send the before and after photos, and it really does help tell your story. This is the same story that you'll be sharing with your legislator on Virtual Advocacy Day. So it's a great way to prepare for Advocacy Day, and then you can verbally share it after you type it out. The NFED may add your story and photo to our personal stories handout we are sending to legislators, so they understand that this does affect a wide array of patients and advocates from all over the United States. We may also use it on our website or social media platforms to raise awareness about the need for ELSA. And there is a link here where you can share that story, or if you just type in nfed.org, share your story and search for it, it will come up. So tips for successful meetings. In terms of effective meetings, your unique and powerful story is the #1 tool in garnering support from ELSA. We repeatedly hear from legislators and different offices that the reason why they signed on to ELSA or they support ELSA is because an advocate shared their story, they spoke from their heart, and they explained the congenital anomaly they have, the medical impact, the insurance struggles that they're facing, and how it's affecting their family. So your story is very important and you need to make sure to share it on these meetings. We encourage you to use notes to share your story. A lot of us get nervous in those meetings, so feel free to read off of those notes. And the offices are used to having advocates do that, so you don't need to be embarrassed or intimidated. Feel free to do that. Practice, practice, practice. I'm going to keep saying that. Each family has 1 to 2 minutes, so you really need to carve out just that 1 to 2 minute story that's going to be impactful. Other helpful meeting tips: arrive 5 minutes early, just as Lincoln said. Team leaders should facilitate the flow of the meeting, set expectations. If you have a 15-minute meeting, mention, we only have 15 minutes. We need to get through this. Let's get started right away. Mute your line when not speaking so that the meeting can flow properly and we don't have to take breaks in between to try to get advocates to mute their lines. Prioritize constituents. So if you're in a group and you have constituents of that district, have them speak first because the member or staff wants to speak to constituents and hear their story. If you have additional time, then the additional families can speak after the constituents. Make sure you focus on ELSA. Don't discuss other legislation or political issues. We're going to be on the Hill to speak about the Ensuring Lasting Smiles Act. And I know that there's a lot of pieces of legislation out there that are very important that you may want to speak about, but this isn't the time for it. We want to focus on this piece of legislation and make sure that all offices understand why we're on the Hill and why they should prioritize this legislation. Take notes and comments or questions that staff or members may have. You can enter those in the notes on the online schedule as well. Make sure that you are kind. And as most staff and members have a very busy day and we want to stand out in the crowd. Staff members usually have back-to-back meetings and they're often very tired because they're talking to advocates all day. So we just want to make sure to keep the meeting as positive and lighthearted as possible and really make sure that the legislative offices know that we appreciate them taking the time to meet with us. So relax, have fun, and stay positive. I just wanted to mention some offices may bring up different legislation or maybe the ACA, for example, and we want to make sure that we bring the conversation back to the Ensuring Lasting Smiles Act. This has often happened in several of the meetings that I'm have been on. And what I usually do is I just say, you know, that's very interesting, or yes, that sounds like interesting legislation or important legislation, but really we're here to talk about the Ensuring Lasting Smiles Act and just keep bringing the focus back to ELSA. And even though you are very passionate about other issues, make sure that you talk about ELSA and don't ever make it negative. We're not there to argue with the members or argue with the staff. We're there to be positive and make sure they understand why ELSA is important. So staying connected and building relationships with offices. As soon as the meeting is done, you need to do follow-up. As Lincoln mentioned previously, there is a survey that you can complete on the online portal. There's also features on the online portal that you can email staff directly through the portal, which is very nice. Try to email them within 24 hours and thank them for meeting with you. Follow-up is just as important as your legislative meetings. If you don't follow up, most likely most of the offices will not follow up with you. So it will be up to you to follow up with them, explain to them why ELSA is important, share any other information that you may have forgotten to mention in the legislative meetings, and then send them any type of pictures or additional information information that you have. If you don't hear back from an office, please email them at their DC office or call them every 1 to 2 weeks. And just ask them if they're still reviewing ELSA, how's it going? Do you need any follow-up information? Is there any other additional information that they need to make a decision? In terms of building relationships, be persistent, positive, patient, and passionate, particularly patient. It takes offices sometimes a couple weeks to get back to you. It's nothing against you. It's just that they have thousands of pieces of legislation that they're looking into. Your legislation doesn't take precedence over another piece of legislation. So you need to just be patient and understand that at some point they should be able to get back to you. And if they don't, send them a kind reminder email that you're patiently waiting to hear back from them. Of course, kindness makes all the difference. Don't argue. If an office shares information with you that you don't like to hear, and sometimes you may get information you don't want to hear, it's then up to you to educate that office. Don't argue with them and tell them what they're doing is wrong. Just share information to try to change their mind so that they want to support this legislation. Let offices know you are looking forward to hearing back from them and that you'll be a resource for further info. Share periodic updates on ELSA. If you look on congress.gov and there's several new co-sponsors, you could always email that office and let them know that there's several new co-sponsors and you're hoping that they'll sign on soon. Like I said, there's thousands of pieces of legislation introduced every year. You need to explain why ELSA should be a priority for them, and then also tag your legislators in the social media posts. So as Kevin said before, if an office says no, it's not the end of the world. You need to take a deep breath. It'll be okay. My senator, I've been meeting with him for several years. He has not signed on. I keep trying and trying. It doesn't mean that if somebody says no, that you give up. You still need to provide information and updates to them and let them know and educate them why you need them to support ELSA. So few bills garner 100% support from everyone on Capitol Hill, and especially a health bill. Health bills, of course, are hard to move forward, but we've done an amazing job educating offices, and we are moving ELSA forward. So it's been going very well. Thank them for clarifying their stance and ask if they will explain why they won't co-sponsor. So if one of the offices says, you know what, I'm not going to co-sponsor, this is the reason why, and you don't understand the reason why, bring that information back to us, type it in your notes, and one of the advocacy committee members will reach out and find out what their concerns are and if we can get them on board. Ask if he or she would be willing to vote in favor of the bill when it goes to the floor vote. So even though an office says they will not co-sponsor, keep in mind that they may still vote yes on that bill. So we don't want to alienate or we don't want to be nasty to these offices. Sometimes when you don't hear what you want, it's easy to get upset during the meetings. And we just want to make sure to keep those meetings positive and find out if they will support the bill in the end, even if they will not co-sponsor. Offices won't co-sponsor some bills for a wide variety of reasons. It does not mean that they won't vote for the bill when the time comes, so just keep that in mind. Also ask if you can stay in touch with the office to share updates on the bill and have your family reach out with information and updates. So now we are going to have a mock legislative meeting, and then we will talk about the social media contest and Q&A afterwards. You ready, Kevin?
Yep. So for everybody's situational awareness, I'll be kind of playing the role of either senator or congressperson. And Becky will be playing the role of a family advocate. This is all impromptu. We didn't plan any of these out, so see if we can stump her.
So hello, Senator Koser. My name is Becky Abbott. I'm from Slinger, Wisconsin. I'm here today with the National Foundation for Ectodermal Dysplasias to talk to you about the Ensuring Lasting Smiles Act, which is Senate Bill 754. My son Aiden is born with XLHED, which is a type of ectodermal dysplasia. He's missing many of his teeth. And he has to have a lifelong treatments to be able to get the teeth and treatments he needs to be able to speak correctly, to be able to chew correctly. And up until this point, we have experienced many, many, many years of denials. And so that's the reason why we're here today. We have several other families here. So I'm just going to briefly talk about Elsa. I just wanted to introduce myself, but I'm going to let the other families talk and share their stories. And then once they're done, I would like to ask you if you have any questions. So what Elsa will do is it will ensure that all congenital anomalies receive the treatments that they need as long as they're medically necessary. So this applies to private health insurance and medical insurance. It does not apply to government plans. So as long as somebody has a congenital anomaly and as long as it's medically necessary, then private insurance would have to cover the repair of that congenital anomaly. So I'll just stop here and I'll let the other families speak. And once they share their stories, if you have any questions, please let me know. So this is where you would let the other families share their stories then.
Great. Thank you all very much for sharing your stories. Well, I bet that's a really tough situation that you all find yourselves in, and I really empathize with where you're at. I wanted to bring up a point that, I've always been supportive of rare disease research and funding opportunities. So every time we have an appropriations bill, I always like to allocate and vote in favor of money for the NIH and their rare disease research. So hopefully that will help you all out. Is that what you're all here looking for me to do?
So I do appreciate that you are supportive of the rare disease community and that you ask for additional funding for, the NIH and additional research. However, that in this instance, it does not help our families. And it would not help with the issues that we're facing. We need you to support the Ensuring Lasting Smiles Act and try to garner additional support with your colleagues so that our kids can get the treatments that they need so they can live healthy lives and thrive.
Okay, understood. Yeah, thank you. I guess is this bill disease specific? Is this only going to help the ectodermal dysplasias community or those with oral congenital anomalies?
Yeah, that's a great question. So you're hearing from my family and we're speaking about the ectodermal dysplasias community and oral defects and oral anomalies. However, this bill is not disease specific. It's actually broadly written so that it would cover the repair of all congenital anomalies, some being oral congenital anomalies, eye congenital anomalies, ear congenital anomalies. We believe that all congenital anomalies should be treated equally. And that anybody born with a congenital anomaly, as long as their treatments are medically necessary, those would be covered under this bill.
Got it. That's good to know because I typically don't support disease-specific legislation. Now, with a bill such as this, I'm sure there must be cost implications and looking specifically at premium impacts and how it's going to impact direct spending and federal tax revenues over the coming years. Do you have any information on that?
Yeah, that also is a great question. And I honestly don't know that information. I can take that question back with me and then ask our advocacy committee. The advocacy committee can get back to you on the specifics of that question. I apologize, and I know it's important information, but if I could follow up with you, that would be great.
Perfect. Yeah, that would be great. Just follow up with my staff and I'll be sure we give this bill a good look. I really appreciate you all sharing your stories again. I can't promise anything at this time, but I can, other than my staff and I will take a very hard look at this bill and see if we can help you all out.
Yeah, I really appreciate it. Thank you so much for taking the time to talk with us today. I know that you're really busy and you're meeting with a lot of different groups today. So thank you for taking the time. If you have any questions, all of our families would serve as a resource. to answer any of those questions for you. If it's okay with you, we would like to reach out and provide updates on the Ensuring Lasting Smiles Act. And once again, I just wanted to ask that you do co-sponsor the Ensuring Lasting Smiles Act. It would mean a lot to our families. We are constituents of yours, and it would have a tremendous impact on all of our families. So thank you again for your time. And if you wouldn't mind, would you mind if we took a quick screen selfie so that I could post on social media, letting everybody know that we met with you today?
Of course, go for it.
Okay, sounds good. I'm gonna take a quick picture. Okay, smile. Okay, thank you. I will make sure to post that. And like I said, thank you so much for meeting with us, and you'll hear from our families in follow-up.
Perfect. Thank you all so much. Take care.
Okay, so we will take questions afterwards about that. Next, I want to talk to you quick about a social media contest that we'll be having. The information should be posted in the next couple of days on social media, as well as go out in a advocacy update. And what we want you to do is we want you to socialize your advocacy contest. We're gonna call it the Socialize Your Advocacy Contest. Stay tuned for details from the NFED. And what it will be is, and we have some great examples here, is we have this poster that will be sent to you, and you can also download it off of social media. And we want you to take a picture of it, use the 2 hashtags Ensuring Lasting Smiles. Ensuring Lasting Smiles does not have ACT afterwards, so make sure that you only use Ensuring Lasting Smiles, as well as hashtag NFED on the Hill 2021. Make sure to include the bill numbers and tag your legislators, and the details will be in the post in the upcoming days. So we have included my email address as well as Kevin's email address here, along with our official final version of our fancy Elsa logo, which is pretty cool and makes me smile. So I just wanted to mention, thank you all for your support in advocating for Elsa. We couldn't do this without you. As we've all mentioned, this has such a broad impact on all different congenital anomalies. Just because you're on the Hill talking about your family, keep in mind that this is going to help so many different families from so many different walks of life that have other congenital anomalies. So let's protect all Americans born with congenital anomalies, and have a great day on the Hill. And at some point, hopefully in this Congress, let's get Elsa passed. And with that, I'm going to turn it over to Kevin, and we can go through the different questions.
Perfect, perfect. So hopefully you all have been kind of following along in the chat. The general chat, I've posted some links. So we do have the links to the House co-sponsors and Senate co-sponsors in there, as well as the NFED's link to share your story. There have been several comments that I've addressed there, but specifically within the Q&A, I'll start reading these. Is there an ELSA graphic that we can use as a virtual background during our meetings? And what you see here in this PowerPoint presentation, there's a new logo that we're using for the bill. We also have the Advocacy Day on Capitol Hill logo. You know, we don't have a recommended or best one to use as a background, but feel free, whether it's a family portrait, something that would be useful to, you know, if it's just you speaking, but you want to talk about your family, feel free to use that. Or if it works, I don't know if one of these logos would work as well, but they'll be, they're included in emails that NFED is sending out to all of the advocates. Next question is, please explain the rationale of bipartisan support in the Senate. Sure, yeah, so great point. So right, it's Democratic leadership in the House, it's Democratic leadership in the Senate. However, the margins are razor thin, especially in the Senate being 50-50. The committee makeup is 50-50. So we have 11 Democrats and 11 Republicans in the Senate Health Committee. Keeping it as bipartisan as possible is absolutely critical. And it's a direct request of our sponsors as well. Given that we have a Democratic lead and a Republican lead, that's the agreement that they've come to as well to help facilitate this bill. Next question, is it correct to say that ELSA will prevent health insurance providers from engaging in tactics aimed at attrition of those pursuing coverage of care for congenital anomalies. Probably, I think I'd have to read that again just to be certain. But yeah, the ultimate goal of ELSA is to make sure that health insurers don't deny or delay medically necessary claims related to congenital anomaly treatments. I know some folks have success, some folks don't. It's very uneven across the board. So that's what we're trying to make sure is that all congenital anomalies are treated equally by all private health insurance. Now, with that said, we do anticipate there will still likely be some private insurance denials after ELSA is passed. It's just the nature of having humans on the other end of a medical claim and having to make a decision, yes or no. So some people might not be aware of this, of the new law, even though they've been trained on it, or even though the health insurance company has changed their brochure on that. So but what this will do is give legal standing to you and your family, and will allow you to appeal legally and say that this is federal law. You're in violation of this law if you don't approve this. Do you have any particular strategies or talking points when speaking to Republican senators or congressmen, as they seem to be less winsome? I'll be honest. I found that just sharing the amount of bipartisan support is absolutely huge in making a difference with all offices. I think if you're talking to a Republican senator, highlight the other Republican senators that have already signed on as co-sponsors. Same with the House. And obviously the House has got a lot more, but talk about the raw numbers. I mean, the fact that right now we have over 50 Republican congressmen and 16 Republican senators, that's huge bipartisan support, especially for a federal health care bill. So I would focus on that. In terms of other strategies, I think that gets too specific into the nuances of and language within the bill. Becky and I and others on the advocacy committee are having these conversations with every office across the Hill and the committee. So if those types of questions come up, we can do that. But for everybody in this meeting, I would say just highlight the bipartisan support. That will help out a lot.
And I was just going to add to that quickly. If you have other members from your state that have already co-sponsored, so for Wisconsin, I usually highlight the Republican members who have already co-sponsored. So if you have one or two Republicans, highlight that and make sure that they know that their colleagues have already signed on, and sometimes that will help push them over the edge.
Perfect. Yep. We had an anonymous attendee say, I'll email them my x-ray receipts. And honestly, it's a great strategy. In your follow-up, when you're sending a thank you, or if you're doing follow-up, just ask how the review is going. Send it in as an attachment. Obviously redact any personally identifying information from that receipt, but it helps tell your story. Let me see this next one. Are we worried about any riders being added once it reaches that point, which could prevent it from passing? No, honestly, at this point, we're pursuing this as a standalone bill. Obviously, when the time comes, it's up to the committees and the sponsors to figure out the best way to push it forward. And option one, and the most preferred option, is to push it as a standalone. All of the committees have the legal right and duty to amend the bill as they see fit. But that's what Becky and I and the advocacy committee are doing in the background. When we're not doing this virtual day on the Hill, we're already having these conversations with all of the committees to keep any amendments or changes or anything to a minimum. We had a question about what is the answer to the question that I posed about taxes and cost impact? And Becky, you said that you would get back to me on. Okay, so the key point there that we were trying to make is, those are the types of details that we don't need every advocate to be able to explain in depth. It can get extremely convoluted and difficult, and we want to make sure that the responses are clear across the board from everybody. We do engage in these conversations about cost and taxes and premium impacts with these offices. All that to say, there is a Congressional Budget Office a score that was published in December. We're addressing those scores with the offices as the questions come up, but it's not something that you need to worry about for this virtual day on the Hill. The primary focus needs to be on your family stories. If they're asking these types of questions, definitely do what Becky did, kind of punt on it, take a note, say you'll get that you or somebody else will get back to them if it would be okay to email their staff. Let me see. Another Kevin, that's great to see. Do you recommend business casual if we are using video? It's really up to you, whatever's comfortable. You know, if you're meeting with a senator or a congressman or congresswoman, maybe you'll dress differently. But honestly, we just want you to be comfortable. Whatever that means for you.
Just make sure to keep it so it's not offensive. And like Lincoln had mentioned, you're going to be meeting with Republicans and Democrats. So if something is written on your shirt that may be offensive or cause some type of disconnect there, I would recommend not having that on.
Definitely. And the last one I see in the Q&A right now, but then I'll go into the chat function, is, are the insurance companies fighting this? No, it's pretty remarkable. You know, I think a lot of folks will see the optic of trying to oppose medically necessary care for children or adults. It doesn't send a good message. So there's no formal pushback. That's not to say there other insurance companies or anybody's having these conversations in the background. You know, that's again their democratic right if they want to reach out to offices on their own. But there's no public opposition at this point. Now moving into the chat function, so I can just peruse that real quick. Give me 1 second. Okay, somebody asked, does this go all day or fixed hours? Should we be off work for the day? Okay, so yeah, so I addressed that in the chat, but you know, it's up to you. Once you take a look at your schedule on Friday, that will allow you to make that personal decision. I am definitely taking off, but if you're only in 3 meetings and they're all in the afternoon, as long as you're available for those meetings, perfect. What we're trying to minimize is no-shows. So if you know you have a work conflict or a work meeting or a personal conflict that you just cannot change and it's at the exact time of your meeting, reach out to Becky up until Tuesday, the 27th. If something last minute comes up on the 28th, reach out to Advocacy Associates on the schedule and on their portal. And just whatever you do, please don't cancel outright with that member's office.
And also keep in mind that all schedules are subject to change, and they do change sometimes at the very last minute. So even though you have the best laid plans and you think you have just the right amount of time to get to those meetings, just keep in mind that they may change and there's nothing that we can do about it. It's up to the member's office, and it could change from the afternoon to the morning and vice versa. So you may miss something if you have something else scheduled.
A couple comments about whether it'd be okay to share photos and stuff during the meetings. Absolutely. Yeah. Use any visuals. My son just received his first denture this past summer. Even if he is not physically in the screen as part of my meeting, I might have his denture with me just to show what a pediatric denture looks like and the things that insurance has denied. But yeah, share photos. There's on a similar comment, there was something about, 1 to 2 minutes is really short. It's tough. Think of this as an elevator speech, right? Everybody's kind of giving their elevator speech really quick up front. And yes, 1 to 2 minutes is quick, but if you have a 15-minute meeting and 15 families are in there that need to speak, 1 minute might be too much. You might only be able to share for 15 to 20 seconds each. So that way you can get all the other information across. Just be flexible. If you're the only one or only one of 2 families in a 30-minute meeting, by all means, go into more depth. Just manage your time wisely and flex as necessary.
And keep in mind also that the team leader will go over all of the nuanced information about the bill. So there's no reason for you to go over the specifics about the bill or the asks or the bill numbers or the co-sponsors. Just keep it to your story and the meeting should move pretty smoothly.
Yeah. One other thing to keep in mind as a helpful hint that I've learned, if you're in a meeting with other folks who have the same condition and somebody has already described in depth the background, so in my situation with ectodermal dysplasia, if somebody has already described how that affects people generally, then make sure you focus your story specifically on how it's impacted you or your family or a patient. There's no need, try to keep redundancy to a minimum, and that'll save a lot of time. You might be hearing my dog drink water in the background right now, sorry. Okay, in terms of team leaders, yeah, team leaders are gonna be annotated within your schedule, so you'll be able to see that. It'll say meeting lead and then have a name. And then in the list of attendees on the schedule, I think there's a star or some type of graphic to depict that they're the lead as well. You know, Lincoln kind of mentioned it, and when the team leads can reach out to folks, I'd highly recommend, it's just a suggestion, you know, like these meetings, it's up to you. Everybody's living a very busy life. I know things come up, but as a team lead, just make sure you know, do your homework on what the request is that you're trying to make sure you know whether he or she is a co-sponsor or not, whether he or she is on the committee or not. And those things are all going to be inside your advocacy portal schedule. But yeah, if you reach out to all attendees, just to introduce yourself and say, hey, I'm Kevin, I'm going to be leading the meeting with you 6 families, looking forward to it. And just so that everybody knows that you are kind of the facilitator.
And on, just to add to that, if you cannot make it to a meeting, please let me know as soon as possible so that I can reassign the team lead position to somebody else. Otherwise, the meeting doesn't go as smoothly because that leader isn't there to keep it going and facilitate it. So as soon as you know that you're a team leader and you won't be able to make it, please reach out to me.
I've had a couple comments in a row about defining medically necessary. Is it okay to talk about the cost of other medically necessary procedures we've endured? Concern about medically necessary part, if they need crowns, root canals, or implants. Okay, so all in the medical necessity part. Medical necessity is going to be determined by the treating physician, and that text is within the bill. If they say that if a physician or a dentist or a prosthodontist or an orthodontist or ophthalmologist, you name it, anybody. If a physician says that so-and-so treatment is medically necessary, yes, that is in the purview of this bill. And it's left vague to include outpatient and inpatient items and services. Items meaning you can think of it as prosthetics, whether it's dentures or lenses or hearing devices. Again, it's left open-ended, so that way it's not excluding anything. And services, whether that's treatments or surgeries or whatever it might be related to the diagnosis and treatment of a congenital anomaly. So it's left wide open for that. In terms of the specific question about crowns, root canals, other things, yeah, so the text specifies adjunctive, dental, orthodontic, and prosthodontic services. So those would be included as well. You know, if this is a secondary thing that would facilitate implants or dentures at a later stage in your life, then yes, that would still be covered in the purview of ELSA. And same thing goes with hearing devices or vision. Again, this is wide open for any congenital anomaly. So if you've received any type of care, medically necessary care related to a treatment of any congenital anomaly, it's definitely worth bringing up to include eye treatments. Peter says, I see that HR 1916 is not called the Ensuring Lasting Smiles Act deliberate. No. So Congress.gov is just being updated. It's backlogged right now. So I don't even think the text is assigned within HR 1916 on the website. Right. The clerk's office just needs to update that, but it is still being called the Ensuring Lasting Smiles Act. Let me check. I'm going through the rest of the comments. For clarification, we send you our 1 to 2 minute speech and photos prior for approval. No, we're not going to approve. We're not looking to approve anything, but if you need feedback, we can help. What the share your story link that Becky talked about is for our back end use. That will allow us to consolidate essentially what we envision as a big book or big printout of hundreds of stories of people who have been affected by congenital anomalies. So if you submit your story on that link, we can then print it out, include it in that book. And when any one of us goes up to the Hill to talk to a committee or talk to a key leader, we can show, here's our massive 5-inch binder of all of our stories from across this country. And that's the purpose of the Share Your Story link.
We do have resources if you don't know what to include in your story that we have on our website. If you can't find it, I can always email it to you. So feel free to reach out to me at any time up until Advocacy Day. And like we keep saying, it needs to be short. So if you don't know what to include, reach out to me and I can give you some tips.
Perfect. And I think the last one from Kevin, which is great name. Did anything change in ELSA from the previous congressional session? Very minor. The overall intent of the bill remains the same. If you tracked ELSA's progress in the 116th Congress, you'll recall that ELSA did pass the Energy and Commerce Committee. They made some what we would call technical amendments. So some of the language changed, but just for clarification. Nothing was changed that would change the intent or how the bill would require insurance companies to do anything, if that makes sense. So yes, the language did change a little bit, but that's it is in line with what passed out of Energy and Commerce Committee last session.
And that may be a question that offices may ask you. Have there been any language changes? And I would just briefly mention, yes, there were some technical changes. The overall goal of the bill has not changed. If you have any questions, we can have the advocacy committee reach out to you and explain those changes. I would also keep in mind that some of the offices may be going through the different versions of ELSA just to see what those changes are before they co-sponsor, and that will take a little bit of time. So that doesn't mean that if you had a co-sponsor previously and they haven't signed on, that there's an issue. It just may mean that they're going through the different versions and they just want to do their due diligence before they sign on again.
One other question here is, what do you suggest to a family that's newly diagnosed? Yeah. I mean, when you're first diagnosed, it can be overwhelming. You may or may not know, you may or may not have heard of this condition, whether you had family history or not. So just kind of talk about your experience on what led to the diagnosis. What symptoms or issues were you or your family or patient experiencing that led to the diagnosis? And you can talk hypothetically. In my son's case, he's 5, so he just got his first denture. But up until that point, everything was hypothetical. I had never been denied by an insurance company before. So I talked hypothetically. I explained that at that time in his life, he only had one tooth. And you can imagine the physical impact and the difficulties he had eating. And unfortunately, we learned from families across the country that health insurance will deny that, even though my health insurance says it will cover treatments of congenital anomalies. So we are anticipating having to spend thousands of dollars out of pocket, even though we have a comprehensive health insurance plan. So feel free to talk about what led to the diagnosis, and then you can talk in hypotheticals. And again, another comment about children in the meetings, that's perfect, yes. By all means, any family member or friend is welcome in the meeting with you. As Becky said, just be mindful of keeping your lines on mute when you're not actively speaking in order to keep distractions to a minimum. But by all means, children, grandparents, friends, whoever it might be, they're all welcome to join you. That's all I see, Becky. So any closing comments?
Thank you, everybody. Like we've said before, we would not have made it this far without each and every one of you sharing your stories, participating in these events, emailing, calling, showing up to town hall meetings. I truly believe that this is going to be our year, our Congress to get ELSA passed. And just by the number of original co-sponsors that we've been able to garner, as well as co-sponsors, speaks volumes of how much support we have on the Hill and how legislators understand that they need to support this so that our kids and loved ones get the will at some point get the treatments that they need and deserve. So that's all I have to say. Thank you all. If you have any questions, feel free to reach out to either myself or Kevin. I'm available anytime for any help that you may need or any questions that you have. Is there any more questions that just popped up?
No, but I think that should be it.
Okay. So that should be it. Thank you, everybody. We look forward to seeing you all virtually on the Hill. Make sure that you log into Facebook if you have time next Wednesday to see the kickoff and view the different messages from our bill leads. It's going to be an exciting day. Thank you all. Have a good evening and see you next Wednesday.
Take care, everybody.